Stop. Before you flush that toilet one more time, you need to pay attention to this. What I'm about to reveal could be the difference between catching kidney disease, diabetes, or even bladder cancer early when they're still treatable, or discovering them too late when your options are severely limited. I'm Dr. Catherine Wells, and in my 30 years practicing internal medicine, I've lost count of how many patients have told me the same devastating story. Doctor, I noticed my urine looks strange for weeks, but I just ignored it. I wish I had paid attention sooner. Right now, your kidneys might be sending you urgent warning signals, and you're flushing the evidence down the toilet multiple times every day without even glancing at it. What comes out when you urinate is literally showing you what's happening inside your body, sometimes months or even years before you'll feel pain, before any symptoms appear, before standard tests will catch the problem. And here's what keeps me up at night. The most dangerous urine colors, the ones that signal serious disease, don't always look dramatically wrong. Sometimes they're subtle. Sometimes people notice and think, that's a bit odd, and then forget about it completely. But here's the truth that gives me hope. If you know what to look for, you have incredible power. You can catch these deadly warning signs early when treatment is straightforward and outcomes are excellent. Your toilet is literally offering you a free kidney and bladder screening every single time you urinate, but only if you know how to read what you're seeing. Today, I'm going to show you exactly what you need to observe, and more importantly, what you must never dismiss or ignore. Something as simple as color tells us volumes about your hydration status, kidney function, liver health, or whether there's bleeding somewhere in your urinary tract that you cannot see or feel. The clarity, odor, and frequency of urination reveal critical information, from urinary tract infections to diabetes to kidney stones to cancer. And at the end, I'll give you 3 powerful strategies to protect your kidney and bladder health starting immediately. To help you understand this clearly, I need to explain what normal urine actually looks like. Healthy urine should be pale yellow to light amber in color, similar to lemonade or light beer. The yellow color comes from a pigment called urochrome that your body produces naturally when breaking down old blood cells. The more hydrated you are, the lighter and clearer your urine appears. The less water you're drinking, the more concentrated and darker yellow it becomes. Your urine should be clear, not cloudy, with no visible particles or sediment floating in it. It should have a mild odor, not completely odorless but not strong or foul-smelling either. And here's what most people don't realize. Frequency matters just as much as appearance. A healthy adult typically urinates 6 to 8 times per day, roughly every 2 to 4 hours during waking hours. Some variation is normal based on fluid intake, but significant changes from your usual pattern are important warning signs. If you're urinating more than 10 times per day without increasing your fluid intake, or if you're suddenly getting up multiple times every night when you didn't before, that demands investigation. Increased urination frequency can signal diabetes, both type 1 and type 2, urinary tract infections, prostate problems in men, bladder dysfunction, kidney disease, or certain medications affecting your system. Color, clarity, frequency. These are your 3 essential monitoring keys. Now let's examine the specific danger signs you must never ignore. Let's start with what seems harmless but often isn't. Very dark yellow or amber urine that persists throughout the day. Yes, your morning urine is naturally darker because you haven't drunk water overnight, but if your urine stays dark yellow or orange all day despite drinking adequate water, this can indicate severe dehydration, liver problems affecting bile processing, or concentrated waste products building up because your kidneys aren't functioning optimally. Chronic dark urine means your body is struggling to dilute and eliminate waste products. This creates a toxic internal environment affecting your energy, cognitive function, and every organ system. If you're drinking plenty of water but your urine remains consistently dark, you need to see a doctor promptly. This could indicate kidney disease, liver dysfunction, or bile duct obstruction. Now, here's a color that terrifies me when patients mention it. Brown or tea-colored urine. This is never normal and always requires immediate medical attention. Brown urine typically indicates one of several serious conditions. Severe dehydration to the point of organ stress, liver disease causing bilirubin to spill into your urine, a condition called rhabdomyolysis where muscle tissue is breaking down and releasing proteins that damage your kidneys, or bleeding from your kidneys or upper urinary tract where blood has been partially processed, turning it brown rather than red. I've had patients come to me with brown urine thinking they just needed to drink more water. In some cases, they had acute liver failure. In others, they were in early kidney failure. Brown urine is a medical emergency. Do not wait. Do not convince yourself it will resolve on its own. Call your doctor immediately or go to an emergency room if it's after hours. Another alarming color is orange urine. While certain B vitamins and medications can temporarily turn urine bright orange and this is harmless, persistent orange urine without an obvious dietary cause can indicate dehydration combined with liver dysfunction, problems with your bile ducts, or certain medications affecting your liver processing. If your urine is orange and you haven't taken any new supplements or medications, and it persists for more than a day or two, get it checked. Now we arrive at perhaps the most frightening color, red or pink urine. This is called hematuria, blood in the urine, and it's always significant. Some people see red urine and panic, thinking they're hemorrhaging internally. Others see pink-tinged urine and dismiss it as probably nothing. Both reactions miss the point. Any visible blood in your urine, whether bright red, rust-colored, or just slightly pink, requires thorough medical evaluation. What causes blood in urine? Urinary tract infections, particularly in women, kidney stones creating tiny cuts as they move through your system, kidney disease or inflammation, prostate problems in men, bladder infections, strenuous exercise causing temporary minor bleeding, and here's the one we must never miss: bladder cancer, kidney cancer, or cancer anywhere in your urinary tract. Here's what's particularly dangerous. Blood in urine often appears without any pain. Many people assume that if something serious was wrong, they would feel pain. Not true. Bladder cancer, especially in early stages, frequently causes visible blood in urine as the only symptom. No pain, no burning, no frequency changes, just intermittent blood that patients often ignore or dismiss. I've seen patients who noticed pink urine multiple times over several months, but didn't seek medical attention because it would disappear and they felt fine. By the time they finally came in, the cancer had advanced significantly. Please hear me clearly. If you ever see red or pink urine, even once, even if it resolves the next day, call your doctor. You need a urinalysis, likely imaging studies, and possibly a cystoscopy, a procedure where we examine the inside of your bladder with a camera. Let me address something people often overlook: cloudy or murky urine. Healthy urine should be clear, like water with yellow food coloring added. When urine appears cloudy, milky, or has visible particles floating in it, this typically indicates infection, specifically a urinary tract infection where bacteria, white blood cells, and pus are present in your urine. Women are particularly susceptible to UTIs, especially after menopause when hormonal changes affect the urinary tract's natural defenses. Cloudy urine combined with burning during urination, frequent urges to urinate, or lower abdominal discomfort almost certainly means you have an infection requiring antibiotics. Don't try to treat this with cranberry juice alone. Untreated UTIs can progress to kidney infections, which are serious and require hospitalization in severe cases. Cloudy urine can also indicate kidney stones forming, diabetes causing excess glucose to spill into urine, or in men, prostate infections. Any persistent cloudiness lasting more than a couple of days warrants a doctor's visit. Now let's discuss urine odor, because smell provides crucial diagnostic information. Normal urine has a mild, slightly ammonia-like odor that isn't offensive. Strong, foul-smelling urine usually indicates infection. When bacteria multiply in your urinary tract, they produce waste products that smell distinctly unpleasant. If your urine suddenly develops a strong, foul odor, especially combined with any pain, burning, or frequency changes, you likely have an infection. Here's a specific odor warning: sweet or fruity-smelling urine. This can indicate uncontrolled diabetes. When your blood sugar is extremely elevated, excess glucose spills into your urine, and certain metabolic byproducts called ketones are produced, creating a distinctive sweet or fruity smell. If you notice this, especially combined with increased thirst, frequent urination, and unexplained weight loss, get your blood sugar checked immediately. Diabetic ketoacidosis is a life-threatening emergency. Another concerning smell is urine that smells like ammonia, stronger than normal. This usually indicates severe dehydration or a urinary tract infection. Occasionally, it can signal liver or kidney problems affecting how your body processes waste products. Now, regarding urination frequency and patterns, as I mentioned, most adults urinate 6 to 8 times per day. If you're urinating significantly more than this without drinking excessive fluids, several conditions could be responsible. Diabetes, both type 1 and type 2. When blood sugar is elevated, your kidneys try to eliminate the excess glucose through urine, pulling water with it and making you urinate frequently. This is often the first symptom people notice. Urinary tract infections causing constant bladder irritation. In men, prostate enlargement, extremely common after age 50, physically obstructs urine flow and prevents complete bladder emptying, so you feel the need to urinate more frequently. Overactive bladder, a condition where bladder muscles contract involuntarily. Certain medications, particularly diuretics, blood pressure medications, and some diabetes drugs. Kidney disease affecting your kidney's ability to concentrate urine properly. The opposite problem, urinating infrequently, is equally concerning. If you're only urinating 2 or 3 times per day, you're either severely dehydrated or your kidneys aren't producing normal urine volumes, which could indicate kidney dysfunction. Pay particular attention to nighttime urination, called nocturia. Waking once during the night to urinate can be normal, especially as you age. But if you're waking up 3, 4, or 5 times every night, something is wrong. This could indicate heart failure, where fluid accumulates in your legs during the day and gets redistributed when you lie down at night, overactive bladder, diabetes, prostate problems, or kidney disease. Frequent nighttime urination severely disrupts sleep quality, affecting your cognitive function, mood, blood pressure, and overall health. It's not just an inconvenience, it's a medical problem requiring proper diagnosis and treatment. Now let me address something many people experience but rarely discuss: foamy or bubbly urine. Occasional foam in urine is normal, usually just caused by the force of urination hitting the toilet water. However, if you consistently notice significant foam that doesn't dissipate quickly, this can indicate protein in your urine, a condition called proteinuria. Your kidneys normally prevent protein from leaking into urine. When you see persistent foam, it often means your kidney filters are damaged and allowing protein to escape. This is a classic early sign of chronic kidney disease. Combined with swelling in your ankles, face, or hands, foamy urine is a serious warning that requires immediate evaluation with urine tests, checking protein levels and kidney function. Now we've covered the danger signs. Let me give you 3 powerful strategies to protect your kidney and bladder health starting today. These are straightforward habits that, if you commit to them consistently, will dramatically reduce your risk of urinary tract diseases, kidney damage, and bladder problems. Strategy number 1. Maintain optimal hydration every single day. This is the most important thing you can do for your urinary system. Your kidneys need adequate water to flush out waste products, bacteria, and toxins effectively. When you're chronically dehydrated, waste products become concentrated, increasing risk of kidney stones, urinary infections, and kidney damage. Here's my specific recommendation. Aim to drink 8 8-ounce glasses of water daily, that's about 2 liters. Adjust this upward if you exercise, live in a hot climate, or take medications that increase urination. The best indicator of adequate hydration is urine color. Your goal is pale yellow, like lemonade. If your urine is consistently darker, you're not drinking enough. Spread your water intake throughout the day rather than drinking large amounts at once. Start your morning with a full glass of water before coffee or breakfast. Keep a water bottle with you and sip regularly. Reduce intake 2 hours before bedtime to minimize nighttime bathroom trips. Here's a critical point. Plain water is best. Coffee, tea, and sodas don't hydrate as effectively and can irritate your bladder. Caffeinated beverages actually increase urination, worsening dehydration. Make water your primary beverage. Strategy number 2. Never ignore urinary symptoms or changes. This seems obvious, but countless people dismiss warning signs hoping they'll resolve on their own. Here's what you should never ignore: any visible blood in urine, even once. Persistent pain or burning during urination. Sudden changes in urination frequency, especially increased frequency or difficulty starting urination. Cloudy, foul-smelling, or unusually colored urine lasting more than 2 days. Pain in your lower back or sides, which could indicate kidney stones or infection. Inability to urinate or only producing tiny amounts despite feeling the urge. Many people, especially men, delay seeking help for urinary problems out of embarrassment. Please understand that doctors deal with urinary issues constantly. There's nothing embarrassing about protecting your health. Urinary symptoms that seem minor can indicate serious underlying problems. Early detection and treatment prevent complications and save lives. Strategy number 3, and this is crucial for long-term kidney health, manage your blood pressure and blood sugar aggressively. Chronic high blood pressure and diabetes are the two leading causes of kidney disease and kidney failure in adults. These conditions damage the tiny blood vessels in your kidneys, gradually destroying their filtering ability. If you have high blood pressure, work with your doctor to get it under 130/80 consistently. If you have diabetes or prediabetes, controlling blood sugar is absolutely critical. Uncontrolled blood sugar directly damages kidney filters, leading to diabetic nephropathy, one of the most common causes of kidney failure requiring dialysis. Beyond medications, lifestyle factors dramatically impact both conditions. Reduce salt intake. Excess sodium raises blood pressure and forces your kidneys to work harder. Maintain healthy weight. Obesity increases risk of both diabetes and hypertension. Exercise regularly. Physical activity improves blood sugar control and blood pressure. Limit alcohol consumption. Excessive alcohol damages kidneys directly and raises blood pressure. Avoid unnecessary medications, especially over-the-counter pain medications like ibuprofen and naproxen, which can damage kidneys when used regularly long-term. If you have diabetes or hypertension, get your kidney function tested annually with blood tests, checking creatinine and estimated glomerular filtration rate, and urine tests checking for protein. Early kidney damage is often reversible if caught early and managed aggressively. Advanced kidney damage is not. Let me add one more critical piece of advice. If you're over 50, discuss bladder cancer screening with your doctor, especially if you're a current or former smoker. Smoking is the #1 risk factor for bladder cancer. Other risk factors include occupational exposure to certain chemicals, chronic bladder infections, and family history. Bladder cancer is highly treatable when caught early, but it often presents with just one symptom: blood and urine. Don't wait until you see blood. If you have risk factors, proactive screening can detect cancer before it becomes visible. Let me bring this together for you. Monitoring your urine isn't just about your urinary system. Your kidneys are vital organs that filter your entire blood volume multiple times per day, removing toxins, regulating blood pressure, producing hormones, and maintaining electrolyte balance. When your kidneys fail, every system in your body suffers. Kidney failure means dialysis or transplant. These aren't minor inconveniences. They're life-altering medical conditions. I want you to feel empowered, not frightened. Knowledge is power, and now you have the knowledge to monitor your own health effectively every single day. Start paying attention today. Every time you urinate, take just one moment to observe before flushing. Look at color, look at clarity, notice any odor. Make this a habit, a simple health check that takes 5 seconds but could save your life. Your health is your most valuable possession, and you have more control over it than you realize. Small, consistent actions compound over time into dramatic results. Don't wait until you have serious symptoms to start caring about your kidney and bladder health. Start now, today, with your very next trip to the bathroom and your very next glass of water. I'm Dr. Catherine Wells, and I'm here to give you the information and tools you need to take control of your health and live your longest, healthiest, most vibrant life possible. If this video has been valuable to you, please share it with your friends and family members, especially those over 50 who need to hear this information. Thank you for watching, and I'll see you in the next video where we'll continue this journey toward optimal health together.